You know, Delmarva Life is a family show, but sometimes we tackle subjects that, although important, may not be suitable for young children. So now may be a good time to send the little ones away from the TV. Our next guest is an Academy Award nominated actress and a documentary film producer. Virginia Madsen has certainly done loads of work in front of and behind the camera, but now she has a role off screen. Virginia is helping women navigate the changes many of us women will go through, changes that come with menopause. And Virginia joins us this afternoon along with OBGYN Ricky Polly Cove. Welcome both of you.
Thank you for having us.
Virginia, I want to start with you. What made you decide to spread the word about changes that occur during menopause?
Well, you know, I was very interested in this subject because I am heading that way. And, you know, all of us will. And I started to hear more and more stories about women post-menopause experiencing sometimes, you know, extremely painful sexual intercourse due to the changes that happen to our bodies in menopause. And I was even more saddened to learn that so many women are not talking about this. They're suffering in silence, and I want to break that silence. There's a wonderful website called findingthewords.com. And if you are one of the women who is suffering from this, it's a real medical problem called dyspareunia, and there is treatment. And you can go to findingthewords.com to find your own words so you can, you know, get together with your girlfriends, discuss it, find out, you know, what's happening with your bodies, discuss it privately with your partner, and hopefully talk about it with your doctor.
Right, right. You're going to break that stigma. Now, Ricky, this next question is for you.
Yes.
What actually causes this condition?
Well, it's a fairly common condition. Probably 4 out of 5 women have it by the 4th or 5th year into menopause. And it's due to the changes of low estrogen levels once the ovaries go on vacation in menopause and stop producing estrogen. And so it's a fairly treatable condition.
And Virginia, why do you think it is important to get women to talk about this condition?
Well, because there's no reason why, if you're going into menopause, that your sex life is just going to go away. There's no reason why you should have this loss of intimacy, because you can imagine what this does to couples, and when one partner cannot enjoy that kind of physical intimacy. And it doesn't have to be mysterious, and it's not that you've done anything wrong, or it's just inevitable and this is the way it's going to be for the rest of my life. No, there is treatment. But for one reason or another, you know, we neglect ourselves while we take care of everyone else. We're busy professionals, or we're raising family, and there's always excuses a lot of times that we can make for not going to the doctor. So that's why we had the website, and it will help you to, you know, how do I bring this up? What should I say?
Right, right.
And, and you can take notes and bring it to your doctor.
Now, Virginia, you're so recognizable. We've seen you in so many movies. Why did you decide to become the face of this?
Well, you know, obviously I don't have any problem talking about any of these issues, but most women are not going to want to go on national TV and talk about anything that has anything to do with menopause or their sexual health. I think it's a really vital part of my life, and so if I can help empower other women just to go to the website, then I feel I've done something really important.
All right, and Virginia, off topic a little bit, want to ask you, are there any projects that you're working on that we can look for you in the future?
Well, coincidentally, I have a movie called The Hot Flashes, which is opening July 12th. It's a wonderful comedy with Wanda Sykes and Brooke Shields and myself, and all trying to play basketball, believe it or not.
Oh.
And but total coincidence that it's, you know, so it's like menopause month for me. We can talk about it all over the place.
All right, Virginia, Ricky, thank you so much. Important information for us women. And of course, if you would like more information on what Virginia and Ricky discussed today, go to delmarvalife.com and click on the show tab. And sticking with women's health, we've been hearing a lot about HPV and how we should have our teenage daughters vaccinated, but it's a problem that affects both women and men, young and old. Up next, we learn more about the virus, how to prevent it, and how to detect it. But first, moments ago we heard more about menopause. That's not the only thing that impacts some of us as we get older. Dr. Oz helps us banish age spots.
Like wrinkles, benign age spots simply appear as we grow older, but you can turn back the clock on these flat brownish spots. The sun draws them out and darkens them, so use sunscreen with an SPF of 30 and 3 to 4 star UVA protection. Screen creams with vitamin C, vitamin A, or glycolic acid can lighten the spots over months. If they really bother you, you can see a dermatologist to discuss treatments like chemical peels.